Good morning and welcome again to Summit. Today's edition is very, very interesting and enlightening. I am Jumoke Michaels. We'll be focusing on an issue that continues to affect the lives of many young Nigerians, and that's drug abuse. The National Drug Law Enforcement Agency, NDLEA, has been at the forefront of the battle against illicit drug trafficking and consumption, especially among Nigerian youths. But how far has the agency gone? What progress has been made, and what more needs to be done? Joining me to discuss this important topic is an officer of the agency, Deputy Commander of Narcotics, Titilope Ogunluyi. She's also the Assistant State Commander, Drug Demand Reduction, NDLEA, Lagos State Strategic Command. You're welcome, ma'am.
Thank you for having me.
Good to have you this morning on Summit.
Thank you.
For the first time.
Yeah.
All right, so for the benefit of our viewers, I know everybody knows NDLEA. It's not a new name. Okay, so permit us to use NDLEA because of the long, I said I shouldn't take our time. All right, so can you briefly explain the primary mandate of the NDLEA and how it operates across Nigeria? Just briefly.
Thank you so much, the anchor person. Once again, I'm glad to be here this morning.
Welcome.
Yeah. National Drug Law Enforcement Agency, NDLEA, we have two major statutory. The first one is what we call drug supply reduction, and the second one is what we call drug demand reduction. When we say drug supply reduction, what we're talking about is when you see our officers, they go all nooks and crannies to mop up all illicit drugs in the society. After they have made their arrest and seizure of this illicit drug, definitely they come back to the office, they provide their case file and do the investigation and forward it to the legal unit and henceforth to the prosecution. That's the first aspect. Then the second aspect, what we do in National Drug Law Enforcement Agency is drug supply, drug demand reduction. Here in drug demand reduction, we go to every nooks and crannies to talk to people about the dangers inherent in substance use. We do counseling, we do rehabilitation, and we do research as well.
That's very good. All right, so talking about the situation itself, how would you describe the current state of drug abuse among youths? Because we want to pay attention to them on this discussion. Is it getting worse or improving? Just the true picture of what the situation really is.
The true picture of the whole thing is that NDLEA is working. You can imagine if you are not in existence, what will happen to our youth? That is it. So we are working, and it's not about the NDLEA alone. It's a holistic thing. Every hands have to be on board, especially parents. Most of us, we have left what we're supposed to do, and we are chasing the shadow, and that is why we're having all this issue. Because a child that you don't train today, tomorrow that child will make you to cry. So every hands have to be on board.
But how far really is the issue of drug abuse among the youth? Because I know that recently there was a program in Ikorodu saying that the youth in Ikorodu area of Lagos, the issue of drug abuse there is really bad. So a holistic picture in Lagos State, how bad is NDLEA seeing this issue among our youth?
Like I said earlier on, see, that's why we are attacking the issue holistically. We know that people that abuse drugs, they are just a victim of substance use. And all of the globe, all of the 36 states and even Abuja, we have rehabilitation center. But we are saying that we are shouting, we're anywhere that prevention is better than cure. Don't let them even start. And that is why you see us, we go to schools, primary, secondary school, tertiary institution. And that is why we encourage people to collaborate with us as well. Some foundation, like what Riley said, what happened in Ikorodu. So if all of us can come on board, Nigeria will be a safe place.
All right, so what are some common abuse substances or drugs you encounter among these young people?
For now, I think at the peak is weed and Colorado.
Weed and Colorado. Okay. Okay, and from your field of experience, looking at the economy of Nigeria, what factors are driving the youth more into drug abuse? Could it be peer pressure, unemployment, depression, or influence from pop culture?
Thank you so much for that question. It's a lot of factors can make the youth to go into substance use. Like you rightly said, curiosity. Curiosity. Because all of us, we know that youth have this energy. So they want to explore and experiment everything. But you know, like I said, if the parents have done the needful and inculcate values and morals into their child, they will not be a victim of evil vices. That's number one. Then peer pressure. They say, show me your friend. I tell you the kind of person that you are. So as a parent, you need to know who is your children, your child's friend. Yeah. What's the kind of lifestyle they are living? Exactly. But most of us, we want to give them the best iPhone and all that. Is that what they need? Do we give them the affection that we need to give to them? We are chasing. I want to be a professional. What about my home front? Who is taking care of my home front? Are my children left in the hand of nanny or house help? So we need to, the parents, we need to do the needful. Then another factor that is really affecting dysfunctional family. You know, in those days, women will say, no, I won't leave my husband's house because of my what? Of my children. But now, nobody cares any longer. Most of our parents are single parents. And when there's a void, there's no vacuum in nature. Something must be filled that thing. So we need all of us need to go back to the drawing board and look, okay, where have we missed it? Yeah, we missed it. We can go on so many factors that affect.
All right.
That can make
All right. So
substance.
beyond arrests and enforcements, what are some of the steps the agency is taking in terms of prevention, education, and rehabilitation? Do you actually arrest these young people? Maybe you do raids and all that. You arrest them.
Definitely, when our operatives they do go for raids. But like I told you, globally now, people that use substance, we refer to there is health issue.
Health issue.
Is an health issue. So they need what? Counseling and rehabilitation.
And do you do that?
We do. I said at the beginning that, okay, all 36 states, including the Federal Capital Territory, we have rehab center there, NDLEA rehab center.
So let me get the picture right. Some of these youths that get arrested, maybe when they raid some of these joints and take them, the arrest is like taking them to rehabilitation center. Is that what you do?
Okay. There's what we
Just
call brief
clarify that.
intervention.
Okay.
We call something brief intervention. So people that if they go for raid and they are being arrested, they bring them back to the office, they do sorting, then they bring them to counseling. We do brief intervention for them. Brief intervention, not rehab. Proper rehab will take 3 months or 6 months.
Okay.
Proper rehabilitation.
Okay.
It's about 3 to 6 months.
All right.
Depending on the substance the person is using, how long and all that.
All right. Okay, so could you share any success stories, specific cases on programs that show NDLEA's progress in reducing drug abuse, especially among the youth?
Okay, thank you so much. Our chairman, chief executive, when he came on board, introduced a program called WADA. That's War Against Drug Abuse. What we do is that we go to all schools, both the primary, the secondary, the tertiary. We advocate the people that really matter so that they can know. You know, information is very important. Most people don't even know about, like I said, when it comes to substance use, it's an health issue. It's not a criminal offense. So we'll go so that people will now begin to see it from that angle, that this person needs help and able to assist them. So we do that. We go to anywhere, marketplace. We go anywhere so that we can tell them these are the things, these are the reports. We talk about the risk factor, we look at the preventive factors, so that our child will not be a victim of substance use. And peradventure they have started, there's a hope for them.
All right, so in all the ways that NDLEA has worked so hard, you know, helping the youth to stay off drugs, has NDLEA worked so hard to the point where you have maybe a youth that you have helped, rehabilitated, and is okay now, who is like an ambassador representing NDLEA among the youth? Have you worked hard that far?
Thank you so much. We have so many youth that we have really assisted in the time past. And I tell you, they are still doing well. Even in this Lagos state, I could remember. But most of them, you know, like I do tell people, you can't tell somebody, this is what I want you to do. If you're doing that, you are getting it wrong. You need to have a conversation with this youth and say, okay, what is, because for every person that are going to substance use, there's a particular factor that makes them to go into it. So by the time you're able to dig deep and get the reason why they're going to the boy, and you need to ask them, what exactly do you want in life? They will tell you. So most of them, they are doing well. They are doing well. Like at least I have like 4 of them. Two of them, they are in London. 2 are in America. They are doing pretty well. Some are in Canada. They are doing pretty well. But the truth of the matter is that we're saying that prevention is better than cure, because treatment is expensive. So don't even we don't want them to start at all.
All right, when you say treatment is expensive, does it mean that the rehabilitation center is government sponsored, or when these people come for rehabilitation through NDLEA?
Okay.
When they come through NDLEA to the rehabilitation center, is government sponsored or they have to pay?
It is not, it is, you know, like I said, it's expensive.
Yeah, that's why.
When it comes to any other issue, but if you bring we call them claims, if you come for treatment, the parent will be responsible for the feeding, that's all.
For the feeding?
That's all.
Okay, all right. Okay, so every agency faces challenges. What are key obstacles the NDLEA is currently dealing with in this fight?
The challenges we are having is about the society. Most of our officers, we have lost them during operations. You know, because they will go for operation and they go and, you know, the miscreant, they will attack them. What we are doing is for our good and for the society at large. So by the time, I think we need more education, more informations, so that they will know that we are not the enemy of the society. We are a friend to the society.
I remember like there was a case last week where NDLEA officers raided a party, a club rather, somewhere in Victoria Island, and the owner of the club started talking like they didn't deserve what they got, that they didn't deserve for that raid, because it's a club, it's a party. Why should NDLEA come in there to do a raid? And they were youths in that party. Can you talk a bit on that, or you can't mention it?
No, yeah, our spokesman,
okay,
our director of media and advocacy, I think there's a write-up on that. He has spoken of as regards that.
Okay.
Yeah.
All right. So, but in your opinion, let's talk about this era of social media.
Yeah.
And music, entertainment. Sometimes when you watch those videos, they glamorize drug use, and this influences young people's attitude towards it. Does NDLEA have any particular plan in that direction?
It's the truth of the matter. Like if you I said something. I said it's an holistic thing. Yes, it's our statutory to do the needful, and I think we are doing the needful as well.
Yeah, NDLEA is doing it.
Thank you so much for that comment. What we are saying is that it's not only drug that is a vice that a child can be a victim of. There are other vices like gambling and all that. But if a child has been inculcated morals and values into a child right from the onset, despite the social media, it will know where to visit and where not to visit. So it still goes back to parenting. It still goes back to parenting. Oftentimes, parents, we have failed in so many areas, and we are now looking for people to what? Teachers.
Teacher, yeah.
No. If you didn't give your child the right values and the morals, the teachers, how many children do you have in a class? Nobody can know a child like the way the parent will know that child.
How are you reaching parents on this? Because you've mentioned parents so much in this discussion. Does NDLEA have any plan or program to actually reach parents themselves?
We do.
Okay.
Like for example, we go to schools. There's their parent forum.
Parent
We talk, we speak to them. We all these CDS and all that. We go. We speak to them as well. Like I said, marketplace, where we know that we have plenty women, because mother, we are the most important in the home. We are the ones that take care of the husband and the children. We speak to them. But oftentimes they are too busy. Availability.
Everybody has to make ends meet.
Yes,
Is the same children you are struggling
at the detriment
for?
of our children. You know, most of my clients will say, Madam Titi, I wish my parents would give me affection than the money they are giving to me. There's a void in every child.
If that void they want to
exactly
cover, it's that void. All right, so in your professional view, what long-term strategies or policies should Nigeria focus on to drastically reduce drug abuse among young people? You remember that there was a time somebody was saying, maybe one of these social media influencers was saying that if NDLEA wants to work well, that they actually need to start testing even our lawmakers on this issue of drug abuse, because of the way some of them behave and portray themselves. So when we want to talk about long-term strategies, this fight against drug abuse, I know you people are doing a lot.
Thank you.
But what would you suggest that they be?
I would say for us to really win this war, I go back to parenting again, honestly, for me. I go back to parenting, because if you're able to prevent this thing from happening, I think that's the best thing. Like I said, you know, if you said, okay, treatment, how many treatment centers do we have? How many, you know, if they're all over the place. And these children, they are children that have, you know, they children that have future, they have great destiny. So we need to curb it from the scratch so that there won't be what? That problem will not even come up at all. Look for solution, and the solution is that the parents should show the real love to those children. The teachers should do the needful as well. You know, in those areas when we were younger, when you get 0 in school, they will put your eyes, they will put your head and all that. What are they trying to do? They are reducing your self-esteem. And some of these parents, so they compare a child to another. Why should you do that? Every child has a strength and a weakness. So why don't you do it on the strength of that child and bring the best out of that child? Everybody is important.
Yeah.
So I think all of us, we just have to do the needful. And when you see these people on the street or wherever, don't make jest of them. Look for a way to help them if you can.
Most of them are very aggressive and antagonistic.
I do agree with you.
Yeah.
But even a madman on the street, if you show that madman love, each time you will recognize you. Is it a lie?
No lie.
Just like a dog. It's garbage in, garbage out. Some of these are people that are wealthy. Look at for maybe like 2 or 3. Okay, I can sponsor this one for treatment. You are contributing to the society.
All right. So finally, for our viewers who may wish to report drug-related activities in their communities or seek help, how can they contact the NDLEA?
Okay. We have a free toll line. Okay.
All right. So what about email? Do you respond to email in case people want to report via email?
We are all the social handle. We are
okay.
all the social handle at NDLEA. We are all on the social handle.
Okay. Now, I still want to ask you a question on this issue of rehabilitation. When these children come for rehabilitation, are they accepted from anywhere? All over the Federation? All over the Federation.
Okay. But the thing is, when they come, we do what we call assessment. We clock them. There's a range that NDLEA can handle. Okay. There's a range we need to refer. So if it's above what we can handle, we make a referral to hospital, psychiatric hospital.
Psychiatric hospital.
If the person needs medication. Because what we do is psychotherapy.
Okay.
Yeah, counseling.
All right. So if the person is referred to hospital, the NDLEA still follows up with payment?
No.
Okay. That will be left for the family?
Yes.
All right. So because I know that so many people have little knowledge about rehabilitation centers. Yeah. Because I have one woman too that has been asking, she needs to take her child for rehabilitation, but the rehabilitation center she got was in Port Harcourt.
Wow.
You know, so yeah, they're all over. So what they need to do is to call NDLEA and report such cases and get the help that they need.
Yes.
All right. So she has reassured that all you need to do, if you have children that need help, they need counseling, they need rehabilitation, the federal government through the NDLEA has a program and opportunity for all that. And that's why they have come on the program today, to enlighten the public that there's actually help for your children, or even an adult. Adults too can
Of
come for
course.
help. So it's
Yeah,
for
there's no
everybody.
age limits.
There's no age limit.
There's no
So
age
you need
limits.
help, you can call the NDLEA and get the help and support that you need. And like she said the treatment is free to an extent.
Yeah.
But at least you can start something. Let them come and start treatment. All right, so it's free. Call the number, the toll line, and get the help you need. Thank you so much. We've been discussing with the Deputy Commander of Narcotics, Titilope Ogunloyi. She's also the Assistant State Commander, Drug Demand Reduction, NDLEA, Lagos State Strategic Command. Thank you for obliging this invitation and coming on Summit.
Thank you for
to
having
lend your
me
voice.
as well.
Thank you so much. All right, so to end the program this morning, fighting drug abuse clearly requires collective efforts. It is not one man's battle. It is not NDLEA's battle alone. It requires collective effort. And then communities, NGOs, parents, individuals, let's join hands together to see that we help one another and be able to reduce drastically the issue of drug abuse in our society.